Hi, my name is Dr. Doon Lee, board-certified endocrinologist with 25 years of clinical experience. Today, I am really excited to share my insights of menopausal hormone replacement therapy. I want to tell you all about how I do things here in my office. I want you to take control of your life and hormone. I truly want to show you your life after 50 can be really, truly better than when you were in your 30s and 40s and possibly in your 20s. That is how I feel. Today, I want to talk about how to take control of your menopause and your hormone. So, you are in your late 40s and early 50s. You were just doing fine until recently. Suddenly, you're not feeling well. You have hot flashes and sweating randomly. You're more moody. You're more angry with your family and friends. You cannot stand your husband or partner. You are really short-fused. Rapidly fluctuating estrogen level can send signals to entire body. Hormones are really interesting because your threshold, below and above which you get symptoms, is so different from any other individuals. You are your unique person. You may go through changes very gracefully, but you may be almost suicidal because you feel sometimes that bad. You go see a doctor, the doctor says, hey, you're fine, you're just in menopause, but you know you're not fine. The symptoms can last only 6 months, but can last as long as you live. Also, most doctors who practice medicine now and are at the peak of their career went through residency when I did. This was 2002 when I started residency training in the United States. Women's Health Initiative data just came out. HRT is so bad, you must stop whenever you see it. I feel so proud to take them off of cancer causing, heart disease causing, hormone replacement therapy. In hindsight, it cannot be further from the truth. Women's Health Initiative trial design was very flawed and erroneously analyzed, but also generalized. In fact, when women start hormone replacement therapy early before age 65, they benefited and benefited greatly. They showed decrease in all-cause mortality, decrease in colorectal cancer incidences, decreased risk of fracture and osteoporosis diagnosis, improved quality of life, just to name a few. In terms of breast cancer, if you took only conjugated equine estrogen, actually there was non-statistical decrease in breast cancer incidences. Nobody talks about that. Bad side effects were seen in women older than 65 when they did not do any hormone replacement therapy and started at the time. So you are between 40 and 60, and your doctor tells you you should not think about it because it is bad for you. I think you may consider switching to another physician. I admit that we have not gone through rigorous training as a doctor about HRT because we were so busy stopping the medication rather than starting hormone on patients. Now I am personally going through it. I've done so much CME. I have felt comfortable before. I am now extremely comfortable prescribing this for myself as well as other women in the same boat. We all know estradiol is needed to reduce vasomotor symptoms such as hot flashes and sweating. If you have a uterus, even if you had done endometrial ablation with your OBGYN, you need to do micronized progesterone or progesterone IUD. Estradiol-only therapy can increase risk of endometrial hyperplasia, meaning thick endometrium, which is a precursor for endometrial cancer. Estradiol is usually liked by almost all women. Most women really like it because they no longer suffer. Estradiol deficiency can manifest in so many different ways. You can have a brain fog, joint pain, short fused, feisty in a bad way, in addition to vasomotor symptoms. Estradiol will reduce all these symptoms significantly, a lot of times completely. Hallelujah moment will come to you. I actually prefer to be in menopause than premenopause because My ovaries had control over me when I was in my 40s, but now, or 30s, but now I have control over my own sex hormone, not ovaries. I have a full command. I really enjoy it. I might be a slight control freak. Micronized progesterone can be very good for about 50% of women in that they just love it. They love sleeping well. Sleep onset is definitely faster than non-taking it. Personally, I did better at 200 milligram dosing than 100 milligram dosing. With the 100 milligram, I didn't have any difference in sleep, although I slept good, but I sleep better with 200. But also I had more unscheduled bleeding. I sleep like a baby now with 200 milligram dosing at night. I look forward to taking my progesterone every night. Some people have no effect. Nothing bad, but nothing good. They sleep fine, but they don't sleep better just because they take progesterone. But since they have uterus, they must take it. On the other hand, I would say about 20% of women, they complain of fatigue, bloating, and depression when they take progesterone. These women do not want to take progesterone. In fact, they hate it. So if you do not like the effect of progesterone in your body, but you have intact uterus and you like to take estradiol, then you should do progesterone-coated IUD to reduce risk of endometrial hyperplasia. Let's go back to estradiol. Systemic estradiol does not address vaginal atrophy as well as vaginal estradiol. That's directly inserted to your vagina. I am big on preventing aging, and the same goes true for your vagina. Why should you only be concerned about the face? Isn't health of your vagina very important? You urinate through it, you make love with it. You need to have healthy vagina. In fact, not taking vaginal estradiol, increased risk of recurrent urinary tract infection. Also, you have pain when you have sex. So do take vaginal estradiol. The way you start is you take one daily pill or cream for 2 weeks. After the loading phase of 2 weeks is over, you will take one twice a week. I use either tablet or capsule. Since cream is a little bit weird to me, some people like cream because they like putting leftover cream to their face. Typically, I start systemic estradiol first because it is what you need the most. After about 3 months, if you have intact uterus, then I start progesterone. I do in stages since progesterone is sometimes associated with side effects. As I said earlier, in order to know what is causing what, I do one sex hormone at a time. As for systemic estradiol, I always do transdermal approach, either patch or gel rather than oral medicine. Pill has first pass effect and you have increased clotting factors and inflammatory markers when you take the pill. Pills also cause your thyroid levels to fluctuate. Pills decrease libido, not increase, decrease libido because oral pill increase something called sex hormone binding globulin, which traps your small amount of testosterone. You already have very little testosterone. You don't want that to be eaten by sex hormone binding globulin and nothing else is available for your body. So I'm a huge fan of patch or gel. I personally apply gel every single morning. I apply gel to my inner thigh right after shower, along with small amount of testosterone, which I will get into later. Then I do my morning routine, drying hair, put on sunscreen, put on my lipstick. Then after about 5 minutes, I apply my retinol body cream to reduce sign of aging on my body skin. I will talk about my skincare routine in the future video as well. As Korean, I am very enthusiastic about my skincare routine and how I was able to achieve good skin at age 51. If you are using patch, I would apply patch once every 3 or 4 days. So you either put on new patch Monday, Thursday, or Tuesday and Friday, etc. Your symptoms will get better within about a week if your symptoms are due to estradiol deficiency. Again, if you have intact uterus, you must take progesterone. So here we talked about estradiol and progesterone. In the next video, I will talk about testosterone therapy in female. Let me tell you, all this talks about testosterone in women. I have started this in 2008. My patient came back to see me after I prescribed physiologic dose for young female. She was about 60 years of age. She came back and said, "Oh, I had the best orgasms in my life after you prescribed testosterone." I was like, "Wow, great." I was only in my late 30s. Okay, I must visit that topic when I'm turning 50. So we will talk about that a little bit later. Please follow my next video since we will talk about testosterone therapy in female. Thank you for watching. Please comment below if you have any questions.